My poinsettia from last year is really hanging in there. Well, thanks for coming again. It's good to get back and talk about some of the things that calcium therapy involves that would be helpful for you. Uh, Mark Manhart with the calcium therapy, dentistry 2020, and I want to talk about. I said I want to talk about endodontics, root canals, and periodontics. Well, the real word is practice. We want to get more and more into the practice, what that involves. And one of the most important things about practice is that the calcium materials have begun for us an excellent diagnostic tool, a way to help figure out what's going on and what to do about it. And in other words, it's environmentalizing, changing the environment, keeping the environment of the mouth. Dr. Berman, years and years ago, decades ago, talked about biological dressing. And that hits me because one of the most intense, successful modes or protocol is using a biological dressing. And back then, I didn't realize what that really meant, but now I think we do, because in terms of the materials that we use, they are dressings. And a physician from that we've worked with from London, she said that's it. It's a barrier. It's a barrier between the infection and the healthy tissues. Another word would be a scab. If you have a scab and you keep taking it off and scratching and everything, it'll never heal. The scab stays there long enough for the under tissues to heal. That's a very critical thing in any kind of wound or infection. If you can change the environment long enough, you really can get it. And we have, what do we have that are environmentalizing this area? We have a paste, we have calcium chips, we have calcium liquid, we have calcium strips. We turn the saliva. It's a great barrier of the whole digestive system. It's the beginning where it prepares the food for chewing. I mean, yeah, for chewing and digesting. And it's a barrier. And when you just take its ingredients, calcium, wow, that is very important for the healing. Zinc, those two things are so important for healing. There are other things too, but in dentistry, that's it right there. And so in environmentalizing, here's what hit us. Years ago, this happened. If you treated the gum tissue, the gingiva, if you treated that with the calcium materials in its paste form, in other words, before it sets up very quickly, the calcium material. But in the paste form, when you're applying it, what happened was the gum tissue, the gingiva just started to bleed. And it was like, holy moly, what's going on here? Because at the time we didn't understand this. Back, I don't know, where is it? 80s, I think, before that we realized this, that if you put the calcium in the form of a paste into the tissues, it reacts very, very fast. Both calcium and zinc react very, very fast, and it's it's actually setting up an environment that's so immediate that the blood just flows out. And so you treat it, and here comes it's bleeding. The patient leans over and rinses their mouth, and they bleed blood. Their saliva is blood. Well, we realize that within a moment, what, 5 seconds, 10 seconds or less, it stops bleeding. Well, we started putting two and two together and we got 16. And it was this. You put the calcium materials into the gingiva, into the gum, around the teeth, and it doesn't do anything. It doesn't do anything. Well, that taught us, and then then on some other patient, you put it on, and you put it under, squeeze it under the tissue, inject it under the tissue. It bleeds. What that told us, you remember putting things together? It told us that if it didn't bleed, there wasn't excessive blood there to bleed. Which meant it's healed, it's normal, it's healthy. If you put it in and it bleeds momentarily, that says there is infection there. There's excessive blood there that's not healthy blood. Well, learning that just changed our whole mentality with this. It's a diagnostic tool. I want to go on here if you don't mind. So that became such a tool that it told us what to do. When you clean teeth, sure, you got to clean teeth in any kind of protocol, but you don't have to go in and dig everything out and scrape and plane. You just have to get the infection out, which is the cause of that infection is the tartar. Get the tartar out. But planing it is out of the question. Don't do it. It isn't it's cutting gum tissue. Hygienists proved this 20, 30 years ago. Dry sockets. You've heard of dry sockets. And it's called, the treatment is cavitation, cutting everything out. Oh, it's the ligament that's there that's causing the problem, which does not make sense. A ligament, a healthy ligament, a ligament that's had itself ripped apart, isn't necessarily infectious, although don't do these cavitations. Take a little calcium, the chips, and just put a few chips in this, and it will work wonders for a dry socket, for infection, having taken a tooth out and it gets infected. And we've seen this even in a case in Greece where it was done by a dentist, and it was so marvelous we couldn't figure it out, and they couldn't figure it out because he started treating, and it immediately started. Within a few days, it no longer was infected. It was environmentalized. It was a barrier. Bone heals very fast, and using calcium is a superb way to get bone to heal. That is especially the case with complex things like the osteoendocystic therapy. Okay, we'll talk about that. X-rays. We look at X-rays as this. We investigate this in our diagnosis, and we take an X-ray to confirm what we already know. Remember, I said you could look at things and you could see things in the mouth, the spacing. we don't have to know anything else. That's very bad anaerobic infection. And there's some other myths. One is that everybody has periodontal disease. No, no, no. Science has done a long time ago that 17 to 20% of the population has periodontal disease, not 77% of the population. No, that's something that we made up to just kind of sell the idea, I think. It's not a genetic thing. There's genetic things, but there are familial things, and that's what this is, which means you lived in the same environment, you did the same things, you ate the same foods, you were with the same people, and so it's really an environmental thing that much like what we're dealing with through virus infections. And please, uh, I'll say this to these specialists. Please don't think that you know everything about periodontal disease for a very simple reason. You were never taught calcium therapy. You were never allowed to learn calcium therapy. And just like I said last time, if you do not take into account calcium therapy, your diagnosis is incomplete. It is almost always wrong. I respect professionals like periodontists, oral surgeons, orthodontists. Wow, great people. Respect other dentists learning other things. You know, it wasn't the greatest scientific era of the world where only the members of the specialty or only the members of the American Medical Association discover things or develop things. Develop is very important because every dentist has to know almost everything they can in every specialty. A specialist tends to have a narrow range, a narrow range. Look that book up, range of experience, and their decisions are the decisions of an extremely narrow ranged education. 50% of the time is wrong. So when you think of this, think this way. You want to know some causes or symptoms is a better word. You know what symptoms in dentistry are? I'll name a few. Dental work, fillings, crowns, extractions, uh, cleaning teeth too much, dentures, a symptom, a symptom. Decay is a symptom. We want to get at the cause. And that's what this whole 2020 dentistry is about. Thanks for sticking around. I'll see you next time and we'll have some more to talk about.